We are back at noon, so I want to welcome everyone back from the brief break and to our final workshop of the conference. Before we dive right in, though, I do want to let everybody know that our sponsor for this workshop is the J. Warren and Lois McClure Foundation. And at this point, I would like to take a moment to introduce Carolyn Weir, the Executive Director of the Foundation.
Thank you. Thank you, Neil. As I mentioned at the conference opening yesterday, we're a statewide foundation affiliated with the Vermont Community Foundation, and we help make the education and training pathways to Vermont's promising jobs more accessible, more visible, more affordable. I asked for your help at the conference opening yesterday, spreading news about our graduation to the Vermont class of 2020 of one free course of their choosing at CCV this fall. So if you do know of students who graduated in the spring and don't yet have a plan for the fall and who might benefit from a free course where they can engage with academic advisors and career services at a time in which they've said goodbye to their high school-based counselors and advisors under unanticipated conditions, please let them know. I also just want to take a moment and share that the slice of philanthropy that I represent at the McClure Foundation and the Vermont Community Foundation makes grants to municipal entities, including schools. We're currently partnering with the VPA to provide funding for mini grants to support public school reopening and student wellness in this time of disruption. And we have many competitive grant rounds at the Community Foundation that awards small to mid-sized grants. And in recent years, I think many of those grant rounds, we've seen that proposals written by young people for youth-led projects where the school itself can be the applicant and receive the money are highly competitive. So if schools in your districts are rallying around ways to create connections with each other, with their communities, or around issues relating to social and racial justice this fall, they should consider applying and could easily get $3,000 to make some magic happen via the Community Foundation's Spark Grant Round. So thank you for all you're doing to prioritize student connection and wellness in this time and in the months ahead.
Thank you very much, Carolyn, and thank you for being a sponsor. We greatly appreciate it. Moving on then, I would like to introduce Dr. Patsy Kelso. She is the State Epidemiologist for Infectious Disease at the Vermont Department of Health. She joined the Vermont Department of Health in 2000, where she worked in a number of infectious disease areas, including HIV/AIDS, hepatitis, foodborne disease, vector-borne disease, zoonotic disease, and influenza, before becoming State Epidemiologist in May 2009. She participated in the development of the Vermont Healthcare Associated Infection Prevention Plan and the Vermont MDRO Prevention Collaborative. She holds a bachelor's degree in biology from the Johns Hopkins University and a doctor of philosophy degree in epidemiology from the Johns Hopkins Bloomberg School of Public Health. She is a clinical assistant professor of medicine at the University of Vermont College of Medicine. Dr. Kelso works closely with Dr. Brina Holmes, both of whom are actively contributing to a strong and healthy start health guidance for Vermont schools. With that introduction, I would like to turn it over to Dr. Kelso.
Thanks very much for having me. Let's see. Can you see my screen okay?
We can, yes.
Because all I'm seeing is myself. Let's see. Okay. All right.
Excuse me, Dr. Kelso, if you look at the PowerPoint on your own screen, that's what we're seeing. So you can navigate from that rather than looking at yourself.
Okay, no, I got rid of myself. So
okay.
if you can see my slides, then I think I'm good.
We're good.
Okay, thank you. So I want to thank Dr. Brina Holmes for largely putting these slides together with her team. Now let me just see if I can advance them. There we go. So Everything I'm going to say in the next 20 minutes or so is subject to change. This is a brand new virus that we haven't seen before the very end of 2019. And so we're still learning things all the time, and this information may change. But as has been said, we feel it's really mission critical to reopen schools. Not only for the learning that they provide, but the social, emotional well-being and the connections that children need to grow. They also provide food and physical activity and other supports for children. And I should have said at the outset, I'm going to move through these slides pretty quickly. I have about just over 30 slides, but I'm not going to read the slides to you. I will progress pretty quickly through them so that we have plenty of time for questions at the end. And our pediatric infectious disease experts in Vermont have weighed in on the school reopening guidance. And in many areas of our response to COVID-19, this was published in the esteemed journal Pediatrics recently. And Dr. Ben Lee was on Vermont Edition this morning addressing these topics as well. So bottom line, this is a short article that you're welcome to read. It's available at no cost online. And sorry about my dog. With me, the garbage truck is coming. I apologize. You may have seen recent data that really supports young children not effectively spreading COVID-19. Although they can be infected, they typically don't get severe illness and don't spread it to other children or to adults. But we do know that there's more recent data just coming out that older children may in fact spread COVID as effectively as adults do. There's still limited data on that. So I would say the jury is still out to some extent, and our infectious disease colleagues are staying on top of that data. So the Safe and Healthy Schools Task Force had a large representation from education experts, health and infectious disease and pediatrics experts, and others like school psychologists, as well as, of course, the Agency of Education and the Department of Health. And the guidance was reviewed by a wide group as well, school nurses, youth, parents, teachers, and others. I hope that you've all seen the guidance. It is published on the website. There's a link to it at the bottom of this slide, and it's got lots of detailed information for a strong and healthy restart to schools. So our main objectives with this restart of school guidance is three things really. It's trying to keep COVID out of schools, so decreasing the risk of people bringing it in. However, we recognize that as we open up society more and people move around more and college is also back in session, that it's not going to be possible to keep it out of schools entirely. So if it does get into a school, we want to work quickly to decrease transmission and slow down the spread. And then the third bullet is containing and actually stopping the spread. And the health department feels very strongly that we have the systems and capacity in place now, we've built up over the last several months, to be able to respond to cases and situations and do contact tracing, identify close contacts and get them into quarantine, and really effectively contain COVID-19. If we didn't feel like that was the place we were in, then we wouldn't necessarily feel that it was safe to open schools. But in Vermont, we're in a very different place than states like Florida and Texas, where they're having lots of community transmission. That's not the case in Vermont. And we feel like this approach is definitely achievable, that we can largely keep it out, but when it comes in, when there is a case, that we can contain it and stop the spread. to help with that goal, those goals, we're recommending that each school or supervisory union or district should have a COVID-19 coordinator in place. And that ideally would be a school nurse or other health professional, and would work with others to implement the health and safety protocols in each setting. The Agency of Commerce and Community Development worked with VOCHA and the Health Department as we are reopening sectors of the economy to provide training for employers and employees, and that is required training on COVID-19 health and safety requirements, and it's available online. I've taken it myself as a state employee. We're all required to take it, and I've also contributed to it. So it's not onerous, and it provides some good information. Getting more into the details of reopening schools, we're using a measured approach with 3 different steps. The first step being schools are closed for in-person instruction. The second step is that schools are open for in-person instruction, but with enhanced physical distancing and for local children only. And Vermont being a small state, you know, local can really mean a pretty wide geographic area. It's not just a zip code or a town level. And then in the highest step, step 3, schools are open for in-person, still with distancing measures, but with less of those types of constraints in place. And what we're recommending is schools start in the step 2. However, we recognize that in order to have bus transportation function, they need to really be in step 3 to accommodate transportation. So schools are in step 2 with the exception of busing being in step 3. But we're also saying that there should be screenings at the first point of contact before children get into the building. And by screening, we mean screening for symptoms that could be attributable to COVID-19. So screening could either be when they get on the bus, when they enter the school building, and in some situations, it could happen at home for students before they come to school. In addition, some more detail about that. The screening really is asking whether they've been in close contact with a confirmed case of COVID-19 or whether they have any symptoms. And symptoms include cough, temperature, respiratory symptoms, but also some of the symptoms that we've recognized are hallmarks of COVID-19, like a new loss of taste or smell. There are additional guidelines for doing temperature checks, and I will say that as we get into the fall and the winter and we're in flu season, you know, this, you know, we may in fact find lots of students and teachers and staff who do have some of these symptoms, but they're due to influenza or another respiratory viral infection and not COVID. So, you know, just to be clear, we do expect that we will encounter some of these symptoms during the school year. As far as school staff and teachers and contractors, it's well known that people age 65 and older and people who have serious underlying health conditions are at higher risk for severe illness from COVID-19. Those conditions are listed there. And we also know that there are other conditions, including pregnancy, that might put individuals at increased risk for severe illness. There's a list of those other conditions that might put people at risk on CDC's website. So again, with our the 3 phases of trying to keep COVID-19 out of schools when it does get into a school, decreasing transmission, and then fully containing it. We are strongly emphasizing that just like all the time, even without COVID, people should stay home when they're sick. This is even more important in the context of COVID. So if someone is showing symptoms or is a close contact with someone within the last 14 days, they should be in quarantine and they should not be in the building. We are paying special attention to students with special health and education needs, and recognize that there may need to be some exceptions or different circumstances that we need to consider. Asthma comes up a lot. It is often believed to be something that would preclude someone from attending the school or work if they have asthma. But our pediatric infectious disease experts have weighed in and they agree that for the most part, students with asthma, if their asthma is well controlled with good medical management, that it's perfectly fine for those students to be in school. And again, paying special attention to the social emotional health of both staff and students. So making sure that we're identifying children who need special supports and making those supports available. As I said, for transportation and busing needs, schools will be in phase 3, but that still means that health checks are required, facial coverings are required, students should be cohorted by age and in assigned seats. The buses should be cleaned and disinfected, and hand sanitizer should be available for the driver. Students should be physically distanced as much as possible, both in the bus and while they're waiting at the bus stop. And whenever possible, if children can walk or bike to school or can get a ride from a parent or other adult, that will decrease the number of students in the bus, which will help prevent transmission. A lot of these things that we're implementing, whether it's cohorting students by age or using assigned seats, those are to decrease transmission, but also so that if there is a case and we identified that a child with confirmed COVID-19 was on a bus, that when the health department does contact tracing, we're more easily able to identify close contacts of that student. It's not necessarily true that everyone who was on a bus with that student is going to be a close contact. If they were, at the front of the bus while the child with COVID was at the back of the bus, they are likely not going to be considered a close contact. So knowing where kids are on the bus can be really helpful in limiting the quarantining and follow-up that needs to happen if there is a case. And along with that, trying to keep COVID out of the schools, there should be signs that people should stay home when they're sick, hand sanitizer, spacing kids out as far as the door they use to get in, just trying to prevent crowds of kids, all close together for periods of time. And despite there not being at this time a statewide mandate or requirement for mask wearing in public, we are recommending or we are requiring them for staff, students, and others in schools. We know that facial coverings are effective at helping limit the spread of COVID-19. And so for that reason, and because people will be together, for a long time in school buildings, we are requiring them. They are okay for anyone, for children age 2 and older, if the children are able to properly take them on and put them off and not suck on them, then it is fine for even young children older than age 2 to wear facial coverings. That may be case by case for very young children. And of course, they shouldn't be worn while people are sleeping or eating. If they're doing outdoor activities, running around and playing, they don't necessarily need to be on, but they need to be close by so that if activity stops and kids are coming together again within 6 feet, that they can go back on. So there will be exceptions, I think, in rare cases for medical or behavioral reasons, and those children will not need to wear a mask, or those adults for some limited medical situations will not be required to wear a mask, but those should be discussed with the individual's own healthcare provider. We are, again, trying to keep the numbers down in groups, whether it's a cohort or a pod, but having smaller group sizes, again, limits the transmission, but also limits the contact tracing and exclusion that would need to happen if there was a case. So spacing people out, using physical barriers, and limiting the sharing of materials, because while touching surfaces is not the main way that COVID-19 is spread, it can be spread in that way. So in step 2, where schools are starting, we're recommending that classes are kept together as much as possible with the same group of students and teachers, with limited mixing of groups whenever possible, keeping kids 6 feet apart, having desks face all the same direction rather than having children be facing each other, because we think that would limit the sharing of the same air if there is COVID. And trying to, again, whether it's in the schoolyard or in the building, trying to keep the same kids together as much as possible. In step 3, those things might be stretched a little bit so that classes could mix together, for example, and we may reach step 3 at some point during the school year. I think that's the expectation. It's just not how we're starting out in September. And the things that we've heard all along about, it's safer to be outdoors than indoors just because of the airflow. Trying to do the best we can to use everything in the toolbox, whether it's masks or physical distancing or being outside, not mixing different groups of kids together throughout the day. All of those things together can go a long way to preventing the spread of COVID in schools. So this applies to not just the classroom, but to libraries, the gym and the cafeteria, playgrounds. Again, physical distancing and not mixing it when possible. We're recommending initially in step 2 that we limit the number of extra people, outside visitors and volunteers who come into the school, that field trips really be carefully selected and be in line with the ACCD guidance related to the number of people in spaces and that sort of thing. Not having parents and families in school when not necessary. Cleaning and disinfecting are getting a lot of attention. Again, COVID-19 is not mainly spread through touching surfaces, but it can be spread that way and it can contribute to the spread. So frequent hand washing, hand sanitizer being available, having people not clustered together, having hallways or doorways go one way, again, just so people aren't facing each other and breathing directly towards each other. Being careful about how and whether water fountains are used, ideally having them be for filling water bottles, but not for drinking directly out of them. That's one option. And I believe schools are also looking into their ventilation and HVAC systems to make sure they're adequate for the size of the space and the number of people that are typically in the space. Food service is another potential challenge, but it's important that we continue to provide nutrition to kids and adults. So there are food guidelines available from the health department in the Vermont Food Code, but there are lots of considerations for how the kitchen could be modified or used differently to accommodate as best as possible the recommendations and requirements. Things like not allowing kids to do self-service so that everyone's touching the spoon one after another, that sort of thing. Signage, we tend to think in this digital world that paper posters and flyers are less important, but they can be a really good reminder if they're posted to remind folks about hand washing. Immunization is going to be important, especially flu immunizations this year for seasonal flu. Typically in Vermont, only about half of our Vermont population, and it varies a little bit by age group between young children, school-age children, young adults, older adults, but typically we're about 50% of Vermonters receive their seasonal flu vaccine. That's going to be really important this year to get those immunization rates up as much as possible, because if we're seeing people with flu-like illness, it's impossible to distinguish flu-like illness from COVID illness without testing for flu and COVID. So potentially if there's flu circulating, we're going to have just that many more people out. So encouraging immunization this year is really important. So if and when there is a case of COVID-19 in a child or an adult in a school, ideally, if possible, wait about 24 hours before cleaning. But then, this is not a biohazard type situation. Cleaning and disinfecting can be done. Ideally, you'd wait a period of time to let any virus particles that are perhaps in the air settle down, and then cleaning and disinfecting, opening windows when possible, wiping down frequently touched surfaces, communicating with staff and parents about what's going on, and that can be done in conjunction with the health department. We have draft letters that you can use the language if you're sending out messages to parents, and then working with the health department on contact tracing to figure out who was a close contact of that person in the school building. And again, it's not necessarily an entire class or an entire section of a school or an entire school bus. The health department contact tracers have a lot of experience now with talking to people about their activities while they were potentially infectious, identifying who is a close contact versus someone who just had casual contact, the type of contact you would have with a cashier in a grocery store, for example, is not close contact. So the health department will work with schools when there is a case to identify who needs to be excluded for a quarantine period. So when we learn about a new case, we get a report from either a laboratory or a healthcare provider. We reach out to the person who has COVID-19, and we ask them questions to help them remember who they were in close contact with while they were contagious. The period of contagion for COVID-19 is 2 days before the onset of symptoms. So if they woke up on a Wednesday morning with a fever and a cough, for example, and they ended up testing positive for COVID, their close contacts would be anyone from Monday of that week if they were symptomatic beginning on Wednesday. As you all know, there are cases of COVID-19 that don't have any symptoms. And for those people, the infectious period is 2 days before the day they were tested and tested positive. So there's a defined period of time where we need to identify all close contacts during that period. And then we reach out to the close contacts, let them know without sharing identifying information, if we don't need to, that they were a close contact of a case and that they need to quarantine and watch for symptoms for 14 days. There's an option in Vermont for people to do quarantine for 7 days. If they remain asymptomatic, they can get a test for COVID-19. And if that test comes back negative and they're still asymptomatic, then they can leave quarantine at that point. They should still watch out for symptoms for 14 days. But over 95% of people who are going to develop symptoms of COVID do it within 7 days of their exposure. So the health department's role is to do the contact tracing. We reach out to the case, identify their close contacts. We will work closely with the school to help determine information we need for contact tracing, but also to help the school identify what the next steps were, depending on who the contacts were, how many contacts there were, should a whole class be sent home? Unlikely, but we'll help make those decisions. It won't be, we won't leave it to the school entirely. The role of the school is, again, to keep track of where people are as much as possible by using assigned seating or taking attendance, and keeping track of visitors to the building so that it's easier, if we do need to do contact tracing, it's easier to identify all of the people who are potentially exposed or who we don't think were exposed, even though they might have had incidental contact with the case. And then what we're recommending for all Vermonters, and staff and teachers are encouraged to do this as well, is to kind of keep a daily journal. It does not have to be detailed, but just to keep track of, the day you went to the grocery store or the day you, gathered together with neighbors or any activities that you do, just so that if you do end up being a close contact of a case of COVID-19 and the health department reaches out, if you do end up being a case, and the health department reaches out to work with you and identify your close contacts, that journal can help jog your memory. Oh yeah, I did go to the grocery store and the library, and my friend's child was over for a play date or something like that. The Agency of Education and the State Emergency Operations Center are working on getting supplies, whether it's cleaning supplies, hand sanitizer, personal protective equipment, or cloth facial coverings. So stay tuned on that. And there are resources available in addition to the health department. You can call the health department main number, and there's an option for school and childcare and summer programs. If it's after, you can call anytime. You may need to leave a message if it's after hours, but the epidemiology teams will get back to you and answer questions. And there's a ton of information on the health department website. So I encourage you to go there. There's a chat bot tool that's actually pretty useful. I've used it myself to find information. So if you're not finding what you're looking for right away through the menus, try the chat bot, and it's likely to be helpful. So that's all I had as a formal presentation. I hope you've had a chance to read the guidance. I know that Brina and her team at the health department have been answering lots of questions, and they are still available to do that. But I'm happy to take questions now.
So thanks very much, Dr. Kelso. At this point, I'm going to turn it over to Susan Holson, who is the VSBA Director of Education Services, to help facilitate the question and answer period.
Thank you, Neil, and thank you very much, Dr. Kelso. I just want to go on record as saying that I had absolutely no intention of turning on my webcam, but my colleagues who preceded me in the earlier workshops did theirs, so I felt some peer pressure. Anyway, moving on. Here are the questions as they were asked. If I find that any are repetitive, I will try to skip them so we can get on, because there are quite a few. There is some confusion about face shields. Teachers are saying that at the Vermont NEA Town Hall, Dr. Holmes said that face shields are okay if used with a mask, not instead of a mask. Parents are requesting that children wear shields and not masks, and teachers are saying shields alone are not acceptable and would constitute unsafe working conditions for staff. Can you clarify that, please?
I can try. There are limited situations where people with some health conditions on the advice of their healthcare provider should not wear a mask or are not able to wear a mask for a full day. In those limited number of situations, those folks can use a face shield instead of a mask. Masks are more effective than face shields simply because they do more to keep any droplets in. Face shields can keep droplets from, going straight out, but they are open on the bottom, so they're less effective than masks. I don't honestly see a need to use both a mask and a face shield outside of a healthcare setting. I think it's one or the other. The vast majority of people will be able to wear masks. It may be a matter of finding one that's comfortable and fits you. I know I have a lot of trouble with my glasses fogging up, but some masks fit differently, and it's less of a problem with some than with others. But for people who can't wear a mask, after speaking with their healthcare provider, I think a face shield is an appropriate alternative.
Thank you. The next question refers to a study you quoted, which I believe is the new information that we're getting now relative to older children and their ability to spread the virus. And the question is, does it make sense to provide more remote or hybrid options for middle and high school students?
Quite possibly. For a couple of reasons. The data is not robust yet, but it does appear from this one study that had a relatively small number of cases included, but that did suggest that older students can transmit COVID more effectively than younger students. In addition to that, we also know that being in school is often more necessary for younger kids, for their social and emotional health, for their learning how to read, for their learning how to interact with peers. And so it's, I think, imperative that younger kids be in school for in-person learning whenever possible. I think it's less important for older kids, and since they may be able to spread COVID more effectively, and because schools are going to need more space to have kids spaced out, it may in fact be appropriate to have the younger grades in school in person and the older grades in school less often, or fewer days, or not at all. And I think each school, needs to look at their situation and their space and make decisions based on lots of factors.
Thank you. This is more of a comment, but relative to the health checks that might be done on buses, then you're suggesting that there'll need to be additional staff on the buses. Is that correct?
Yes, I believe so. But I don't know if Secretary French or someone else can speak to that more directly.
I'm not sure that he's still with us.
Okay.
And do you have any thoughts on logistics of point of contact screening during extreme weather conditions?
Yeah, that's a tough one. I honestly haven't thought too much about it. It may be that if schools are in session on a really cold day, for example, that you're not going to want to have kids wait outside the bus while everyone gets screened, that you'll want to get kids into the bus more quickly. I think the answer is you should do the best you can given the circumstances, and that may look a bit different from one day to the next. But if we want to have kids in school and we need to get kids to school, we're going to need to be a bit flexible at times, given whatever the circumstance is. If it's pouring rain, maybe you get all the kids into the bus and then take their temperatures or something. It's not ideal, but we have to be realistic at the same time.
Okay, thanks. So next question is, what can you do to avoid confusion between the flu and COVID since the symptoms are so similar?
Yeah, that's it's going to present a challenge not only for schools but for workplaces and businesses and everywhere. So one thing again is encouraging seasonal flu vaccination, because if we can prevent that many more people from getting the flu, it means there's that many fewer confusing situations we'll have to face. And since there is a vaccine for flu and there's not yet one for COVID, the health department is going to be encouraging people to get their flu vaccine. The other thing that will do is, we know that flu vaccine is not 100% effective. It's sometimes less than 50% effective. But that doesn't mean it's not effective at all. And what it does do is prevent more serious illness and hospitalization and death, even though some people who are vaccinated might still get the flu. That's important though, because if you remember back to March and April, the reason why we had to shut down so much of the economy in Vermont was to protect the healthcare system and its resources. And make sure there were enough hospital beds, including ICU beds and ventilators, available for people who got COVID and needed them. If we're in a situation where there's lots of flu circulating and the hospital beds are full because of flu, and we also have COVID still circulating, the pressures are going to be on to restrict more areas of the economy, much like we did back in March and April. So there's so many reasons it's important to try and keep the flu burden down this year, and we can make progress on that by making sure people get their flu vaccine. But your original question, the confusion when someone presents with a fever and a cough this winter, and how do we know if it's flu or COVID? I think the answer is they're going to need to be assessed by a healthcare provider and tested. And that's the only way we'll know.
Thanks. And tying into that, the next question asks whether schools will be able to do anything to facilitate efficient testing of suspected COVID cases.
That's an interesting question. Testing, I'm not sure. Testing is really going to be focused on people who have symptoms that might be due to COVID, or people who are known to be a close contact of a case, whether it's in school or out of school. We're not recommending broad testing of every asymptomatic student once a week or anything like that. So I think what schools can mostly help with is keeping track of where kids and adults are in the building at any given time, so that if we do need to do contact tracing because there's a case, we know who those contacts are.
Okay. I'm not sure this one is really in your ballpark, but we'll give it a try. How would you see dealing with the inequity of asking students not to ride buses because some families are not in a position to bypass the bus options?
Absolutely. There are so many potential equity issues that COVID presents, and just simply the fact that some parents may choose to keep their kids out of school entirely and do learning at home, and that's probably more likely to be parents who have the means to do that than parents who don't. So lots of equity challenges. I know that I've spoken to some or heard of some pediatricians who definitely plan to send their own kids to school, even though they could, hire someone to teach them at home, for example. So I think it's a tricky issue, and we recognize that there are inequities, and we need to just do as much as we can to make sure that all kids have access to the things they need. There are going to be some kids who, for a lot of reasons, have to ride the bus because their parents work or whatever, and then other kids will have other options.
Many teachers feel like they're working twice as hard, doing both in-person and online teaching. The question is, how can we support them? And I'll enhance that question by asking, does that put them at any extra risk of being vulnerable to contracting COVID?
Maybe you can expand on that second part a little bit more. As far as the first part, I don't think I can really speak to that as a public health professional, but maybe Secretary French or others who are more in tune with what it means and what the demands are to do both in-person and remote learning. The only thing I could say about your second question is, if teachers and staff are in the school building, it should be a pretty safe place for them to be. We think that we'll be pretty effective at identifying cases and doing contact tracing and limiting the spread. Being at home is, depending on who else is in your household and what their activities are and whether they're going to work or whether they're vulnerable, all of those situations are going to be different for everybody. So it's a challenge.
I guess what I was asking with the second part of the question is whether somebody who is overextended and perhaps run down has created a more favorable environment for the virus.
I see. I haven't seen any studies on that, but it just may be that those studies haven't been done because this is too new. So that's possible. I don't know that we know for sure.
Okay, this next question really is not for you. I think somehow Can a district choose to offer only in-person schooling, or are they also required to offer a remote or hybrid option as well?
That's probably for the Agency of Education, but my understanding of the hybrid guidance is that schools can choose what works best for them, whether it's fully in-person, a hybrid of some in-person and some remote, or fully remote. And there is explicit guidance on hybrid learning, which I think addresses that question. And it should be on the Agency of Education website.
Okay, thanks. You had talked about the importance of flu shots this season, so this question builds on that. Can schools hold flu shot clinics with parental permission, or even after school hours but on campus?
Yeah, our immunization program at the health department is working really hard right now to gear up for some school-located influenza vaccination clinics. And there are two important reasons for doing that. The first and most important is to increase the immunization rates for flu vaccine by making the vaccine easily accessible to everybody, including kids in schools and teachers and staff in schools. The second reason for doing those school-located flu vaccination clinics is to get that experience implementing those types of clinics so that when there is a COVID vaccine available, we can learn from how the flu clinics went so that our COVID vaccine clinics are that much better.
Got it. How do you feel about the validity or reliability of self-reported health checks, meaning parents submitting an online form every morning saying they've checked their student's temperature and answered the relevant health questions? It seems to me that after the first couple, and this is not me speaking, this is the school board member who asked this question, but it seems to me that after the first couple of weeks of school, people may give up on filling out forms, honestly.
Yeah, you know, this is all new. It's new to the parents who are going to be asked to do it, and it's new to the public health officials, and it's new to the school officials. So I think the answer is we have to try it. If we find out that parents aren't really doing it, then we need to either educate them broadly the importance of it. We also need to be vigilant about school nurses and other adults in schools, sort of keeping an eye out for symptoms in case a parent either didn't do the screening or missed the symptom, or the symptom just developed since the kid arrived at school. So I think, you know, we're going to have to just do our best.
And on a related question, we've been reading and hearing that people who become infected can actually be contagious up to 2 weeks before exhibiting symptoms. So what's the value of the temperature checks and the other symptom checks?
Yeah, that's a good question. To my knowledge, we are not aware that people can be infectious for up to 2 weeks before the onset of symptoms. It's 2 days before, and CDC has a fair amount of data on this at this point. They continue to reassess the data and look at the guidelines. At one point, they were advising us early on, back in March or April, to do contact tracing going back further than 2 days. And then they actually pulled that back and said, no, you know, there's no evidence of transmission prior to 2 days before symptom onset. So you really only need to go back 2 days. The reason that when we identify a case, the contact tracers have two objectives. The first is to go back 2 days before either their positive test or their symptom onset to identify their infectious period and identify who their close contacts were during those couple days so that we can reach out to them and do contact tracing. They're also asking cases for their activities in the past 2 weeks. because that gives the health department an indication of where they might have gotten infected themselves. We're not doing tracing of close contacts, 2 weeks back. We're only going 2 days back. But if someone says, yes, 8 days ago, I attended a protest and I wasn't wearing a mask and most of the people there weren't wearing a mask. Absent any other known exposure, that protest may in fact be there where they were infected. But they weren't infectious themselves at the time they were at the protest. We think that's where they picked it up. So that's why we're asking about activities going back a couple weeks. And I'm not picking on protests by any means. But the time when someone is infectious to other people really is only 2 days before their own symptoms start.
And related to that, the next question is, will there be guidance on how long a student or group of students will be excluded or cleared to return to school?
Yeah, we've also got a lot of data on that at the national level at this point, and it's really clear that it's 72 hours from resolution of symptoms, and then 10 days since symptoms first started. So the simple way, and there's guidance on our health department website and on the CDC website, but the simple way to think about it is, as long as your symptoms have resolved, if it's been 10 days since your symptoms started, you're no longer infectious. So even healthcare providers who work in a long-term care facility with very vulnerable, frail populations can go back to work if it's been 10 days since their symptoms started. At one point, several months ago, CDC was saying there's 2 different strategies you can use to decide when it's okay for someone to go back to work after they've had COVID. You can either do repeated testing to see if they're still positive, or you can wait 10 days. And in the last month or so, they've changed that guidance and said, we know that some people who have COVID-19 can have a positive test for up to 2 or 3 months after their symptoms first started, but there's no indication that those people are infectious. And it's just that the nasal test is so sensitive and it's picking up bits of viral RNA, but there's not actual live virus still in their nose. So CDC has really strongly said, don't keep testing people because you may find that they're still positive, but they're not infectious if it's been 10 days.
Okay, thank you. Should school boards with limited nursing, like 1 or 2 days a week, advocate for additional hours?
I'm in favor of that as a public health professional, not just in the times of COVID, but because there are other illnesses that go through schools and for which it would be helpful to have a health professional around, whether it's pertussis or flu or norovirus or other things that you've probably all experienced going through a school. And I think in the context of COVID, it's even more helpful to have a health professional around, but I can't speak to the policy implications of that, and I'm also not speaking from an agency of education perspective. I'm only speaking from a health perspective.
Can you please clarify the mask requirement? Did you say all students aged 2 and up should be wearing masks? So that would include preschoolers?
For the most part, yes. The general guidance from CDC is that it is okay in most circumstances for anyone aged 2 years and older to wear a mask. However, if there are behavioral issues, or if very young children, like a 3-year-old, constantly sucks on their mask or something, then it's probably not safe. Or if a child has developmental delays or other reasons why they can't easily take off their own mask, then they shouldn't wear a mask. But in general, for the most part, children aged 2 and older can wear a mask, and we are requiring it in the school restart guidance for all students, staff, and teachers, with limited exceptions.
Okay, thanks. This one comes from a superintendent. We're hearing that fans should not be used in classrooms as a precaution against spread. True?
I honestly don't know. I would say more than fans, it's an issue of, is the HVAC system adequate? And I think school buildings are looking into those issues now to make sure the system is adequate for the size of the building and the number of people in the building. I can't honestly speak to fans. I do know that we say that if possible, if weather conditions permit, windows should be open to allow more airflow. And so that seems to suggest to me that a fan wouldn't be a bad idea. But I honestly haven't seen anything about fans.
If there's a confirmed case in a school, should the school be closed for a period of time?
Most likely not. If there's a confirmed case in a school, whether it's a child or an adult, we will know which rooms that person was in. Were they in 2 different classrooms plus the cafeteria plus the gym, for example. And we can focus on cleaning and disinfecting in those areas of the school where the child was. For the most part, the child would not have had close contact with the majority of other children and teachers in the building. And so I find it hard to imagine a scenario, unless it was a very small school where all the kids and adults, mixed together every day, which, we're not recommending. I find it very hard to imagine a scenario where we'd close a school, recommend closing a school, or even having a whole classroom stay home. A classroom is more likely than a school. That is definitely not going to be in every circumstance where we say the whole classroom has to quarantine.
Okay, thanks. We talked about face shields earlier. This is a really specific question. Can teachers use face shields when teaching students who read lips?
Absolutely.
That was a quick answer. I had a feeling it might be.
Yeah.
Okay. Given the temperature variability at the start of the school year, should schools contemplate early release days when there is elevated outdoor temperature?
I think that's really a question for Agency of Education. My gut reaction is yes, that seems to make sense, but I probably shouldn't try and answer that question.
Okay. Could you please let viewers know the age range of older students that the study you referred to has identified in terms of making that distinction?
I believe it went up through age 19. However, I'm not sure the breakdown of, how many of the older teens were in the study versus it being mostly 12 to 14-year-olds, for example.
I suspect that the concern here is it 8-year-olds, 10-year-olds, 12-year-olds, rather than the high end of that range.
Yeah, so what I've seen is that there seems to be a break point at age 10 where children, and I don't know if it includes 10 in the lower group or the upper group, but children younger than 10 are not believed to spread COVID very effectively to their peers or to adults. However, children older than 10 do seem to spread it more readily than younger children, younger than 10.
Okay. This, again, may be outside of your comfort zone, but what's the level of concern given the current atmosphere surrounding masks possibility of putting employees tasked with assuring compliance in an awkward position with parents, with students, with the bus drivers, with other people they come in contact with who are being required to wear them.
Yeah, we're struggling with that at the state leadership level, whether to require them outside of schools. And, I think the governor's feeling and the feeling of his team is that if we can achieve a high level of compliance without making them required, then that's ideal. We're not sure that a requirement would increase compliance. However, the evidence that masks are effective in slowing and reducing the transmission of COVID, that evidence is clear. And so, our input from our pediatric infectious disease colleagues was that there's enough evidence to support requiring them in schools to do the most we can to protect students, staff, and teachers. And we know it's challenging in the situation of when they're not required. For example, for customers who go into stores, sometimes a store requires a mask, and they're put in conflict with customers who don't wear a mask. So we know those challenges are out there. There will likely be similar challenges in school settings where they are required. It's a tough issue.
Yes. And another one related to mask wearing. Will all of this mask wearing and hand washing and hand sanitizing that everybody is engaging in now help keep the flu at bay this upcoming season?
It should help. It certainly can't hurt. And I do think it will help. The messages about staying home when you're sick will certainly help with flu. To the extent that people are covering their faces so they're not expelling respiratory viruses, whether it's flu or RSV or COVID-19, into the air and onto surfaces that other people can then touch their face and become infected. Yes, I think all of these things will help with flu as well as COVID. The difference being with flu, we also have a vaccine that is at least somewhat effective. And so we're encouraging that as well. With COVID, there are no other options. It's simply staying home when you're sick, social distancing, wearing a facial covering, and hand hygiene. That's all we've got.
Okay. So in our previous sessions before you joined us, we were meeting with a bunch of legislators, and the topic came up that when they resume session in August, they will do so remotely because it's not considered safe for them to meet in person. And the governor is still in the state of emergency recommending state employees are working remotely, and most whoever can. So this question is, so why is it safe to open up schools?
Yeah, we still feel that social distancing is one of the key strategies that we have to prevent and reduce the spread of COVID-19. And COVID-19 is still circulating in Vermont in low levels, but it's circulating in much higher levels in many, many other states. And so we may indeed see additional disease activity in Vermont with tourism and travel and the opening up of the economy. So social distancing is still really important, as are staying home when you're sick and washing your hands and wearing a facial covering. We think that the things that schools provide, whether it's the educational learning or the social and emotional supports and help or the nutrition support, all the other things that schools provide make them so key that we really need to get kids back to school. We've described it as mission critical to open schools, especially for the younger kids.
Okay. In addition to slowing transmission of COVID, I believe this is a board member, asks, I've heard there was a recent finding that medical or surgical masks also protect the wearer. Have you heard this?
I have not, but what I do know is that, what's really needed to prevent the wearer from becoming infected is a fit tested N95 respirator, because that really keeps particles out. Cloth facial coverings and surgical masks and procedure masks and those types of non-medical grade face masks do more, we think, to protect others because they keep our droplets in. But to some extent, they also can keep some droplets out. So I think all of them, surgical masks, cloth facial coverings, bandanas, whatever, over your nose and mouth, mostly help others, but also to a lesser extent protect the wearer.
I believe you've touched on this, but this question is very specific. Should fabric surfaces be removed from classrooms?
Not necessarily. I think, non-fabric surfaces are certainly easier to wipe down and, with a disinfectant than an easy chair. But we can't remove all of those types of things from our environments, whether it's at home or out in society or in schools. So I think it's a matter of doing as many of the things as we can, as often as we can, to reduce the spread. But it does not mean that we need to never go back to school or never have fabric or other things that we touch that can't be disinfected. I think we need to, just do the best we can as often and as much as we can, recognizing that we're not eliminating the risk entirely.
And I think that you've touched on this, but this is really specific. When students are eating lunch in classrooms, what is the recommended distance between them, since obviously they won't be wearing masks?
Yeah, it's still 6 feet. 6 feet is the guidance, whether kids are eating or not eating, or wearing masks or not wearing masks. Again, it's a matter of doing as much as we can, as often as we can, whether it's physical distancing, wearing a mask, washing hands, staying home when you're sick. It's, you can't always do all of those things, but you should always do as many of them as you can.
And we are down to our last question, which is perfect timing. As this is an airborne infection, I'm very concerned to learn that water fountains will remain open as long as cleaned frequently. As an APRN, having worked large-scale disasters, even non-COVID times, all water fountains are closed down to prevent and/or break chains of infection. Would you consider closing down water fountains and/or providing an alternative way for students to get water, like bottled water or filling of water bottles? Because a lot of the stuff that happens around the water fountain means that the masks are going to come off. And how does the school know when anybody has used the fountain and thus it requires cleaning?
Yeah, those are tough ones. I think schools are considering, I have heard discussion about, having a water fountain still be open, but only being allowed to be used to fill a water bottle, not to drink directly from them. So that's one option. I don't know that the health department is ready to say that water fountains should all be shut down completely for drinking directly from them. But hygiene is important. So it's always important when you drink from a water fountain not to touch it with your mouth. And again, we can't eliminate all the risk. There is still risk in the environment. So shutting down water fountains for drinking directly out of them is another thing we can do, but I don't think it's something we necessarily need to do everywhere if there aren't other good options for getting water in that setting. I don't know if that's really
and the same question included a question whether water fountain transmission was somehow involved in a spread of polio at one time, if you're aware of that.
I honestly don't know, but polio transmission is different than how COVID is predominantly transmitted. You know, polio is more a waterborne fecal oral route of transmission, whereas COVID is more of a respiratory route of transmission.
Okay, thank you. Right on time, Neil. 1:15. I throw it back to you, Dr. Kelso. Thank you.
Yeah, and thank you very much for joining us today and for taking the time to meet with all of these folks. And with that, gang, I do want to say that this concludes our conference this year, Leading Vermont Public Education in a New Era. We would like to say one more huge and sincere thank you to all of our presenters and the organizers. And actually to all of you board members and superintendents as well. For the superintendents, I know that you have almost an impossible task ahead of you as we head into the fall. And school board members, I know, are facing some very challenging times as well. We are membership organizations, so we are dedicated to helping out our members through these times. So please don't hesitate to reach out. And I do know that the strength of our organizations comes from you folks as well. And so with that, I do want to let you know that we will be in touch with some follow-up materials and a conference feedback form. Your feedback is critical to making sure that we can hold some very effective conferences in the future. And we certainly appreciate that feedback as we navigate conferences in a virtual world. So once again, thank you everyone for attending. Thank you to our presenters and organizers, and hope you have a great rest of your week. Thanks.